3 years ago, I was standing right in this spot, feeling more stressed than I ever have in this room before. I just turned around, I was facing the other way actually, coming to terms with the fact that I just caused my first vascular occlusion. I think part of me always hoped it would never happen to me, but of course we know that it will happen to all of us eventually if we keep on injecting. On that particular day, I learned some really important things by going through the process from start to finish on my own. It's one thing helping another clinician with a vascular occlusion, and it's another thing reading about them. It's a whole different thing when it's someone that you know and like and you've caused a potential injury and you've now got to get them out of that situation. There were 3 key things I learned on that day and I want to share them with you now. The first thing is you need to have a great consent process. One of the things I think all clinicians should apply is the consent should be an emotional journey where you tell the patient the most risky thing and then you lead them out of that scenario through the words you tell. That helped me immensely on this day because I'd already said you could get a vascular occlusion, it could cause a scar, but if it was to happen, I'll diagnose it immediately and I will treat you with a reversing agent that will restore blood flow to your lip. The next thing that I learned on that day is the immediate way that you do your capillary refill test to diagnose an occlusion is really important. There are lots of ways that you can subtly decrease the sensitivity of that test. And in fact, the first time I checked, I thought maybe it was normal. And then I tried a different way and I got a slightly different feeling about it. I kept trying and triple checking, and during that initial vascular occlusion I realized that there's a specific technique that made it very clear that there was a vascular occlusion, whereas other versions of it made it a little bit less clear. Being certain in that environment is absolutely crucial for you to keep your patient safe. You must be prepared to execute, and to be prepared to execute you must be certain that you're dealing with the right thing. So the CRT technique is crucial. You must push on both sides of the face to compare either side. You must push hard enough to actually squeeze the blood out of the skin so that it's as white as possible as you lift off. And you must compare it with a control because sometimes it's just not as clear to your mind, particularly if you're stressed out, what a difference there is in blood flow between either side of the face until you compare both together. And then what became a doubt in my mind became certain. There is an occlusion here, I must act. That is a really helpful state to shift your brain into when you're in this stressful situation. The next really important thing I learned on that day was how important it is to relate your clinical knowledge of anatomy to the diagnosis you're trying to make. We need to be absolutely clear how much of a blood vessel is blocked. Too often we get tunnel vision and we focus on just the area that we injected. And what I discovered on that day is actually the occlusion was slightly bigger than I thought, and it branched out of the pink part of the lip into the white part of the lower lip, where the inferior labial artery was running into the lip. And this hugely changed how I did my reversal. I suddenly had an extra area to focus on, quite possibly the most significant part of the occlusion that I may have missed. In fact, I did miss it for the first few minutes because I was so focused on the pink part of the lip that was white. So always relate your clinical anatomy, which is why I have this anatomy poster in my room, is so that I can constantly look up and check and make sure that I'm mapping out the whole of the vascular tree to make sure I'm being really holistic and keeping my patients safe and making sure that everything is understood in the face rather than just the little bit that you're looking at. See, the problem is panic clinicians don't think clearly. This is true whether you're an airline pilot or whatever your job is. When you get stressed, you tend to think less clearly. So the key thing is panicked and stressed clinicians make bad decisions. You can't weigh up what's in front of you well. You can't execute decisively and with confidence. We absolutely must learn to get control of the emotional side of this situation so that you can keep your patients safe. I go into way more depth on this on the webinar, so make sure you've saved it to your calendar and I'll see you then.